The World Health Organization's Director General Dr Tedros Adhanom Ghebreyesus is expected to speak soon at the mRNA vaccine technology transfer hub and other facilities in Cape Town. He's here in our country today. Our reporter Athi Mtongana following the story for us. Athi, good afternoon to you. What are we expecting?
A very good afternoon to you, Stephen. We have gotten a glimpse of Dr. Tedros, who is flanked by a number of officials that are here from various departments, of course, including the Minister of Health and some of the officials from the Department of Science and Innovation. I am joined by the Director General, Dr. Phil. Thank you so much for your time this afternoon. I was mentioning to Stephen now about how we've gotten a glimpse of Dr. Tedros while they're doing their inspection and their walkabout now here in Stellenbosch. Talk to us about your engagements with him. We know that he's here in the country, particularly to look at the progress of what Africa is doing to be self-sufficient in as far as the production of vaccines is concerned. What have you spoken to him about on a one-on-one?
Well, the first thing is you remember that last year in June, July, the World Health Organization together with the Medicines Patent Pool were looking for low, medium income countries that could produce vaccines. We were then asked to submit an expression of interest, and we were then awarded the opportunity to be the first country in the low, medium income country category to get the knowledge and the technology transfer for the manufacturing of the mRNA vaccine. We then chose Afrigen, which is a local company, BioVac, which is a company also based in Cape Town, together with the number of universities to then get the knowledge know-how from a number of countries and institutions abroad to manufacture our own vaccine. So they are here together with the Ministry of Development Policy and Urban Policy from Belgium. We're also supported by ambassadors from France, ambassadors from the European Commission, and ambassador from Germany, and of course Belgium, to look at the progress that we have made since that announcement was made. So this morning the DG had an opportunity, and the minister from Belgium, to see the developments that are happening at Afrigen, and they saw that we are already able to produce at a lab scale an mRNA vaccine, and we are also beginning to test this vaccine, and we will in the next couple of months, we continue to optimize the processes, and then in the next couple of months we will be going into clinical trials with the hope that in the next couple of months, 6-9 months from now, this will be transferred to BioVac, and then we'll start to produce vaccines for ourselves here in South Africa and the rest of the continent. So our conversation with him was wanting to know if we are making progress, what are the challenges that we are experiencing, and what role they, as the World Health Organization and a group of these countries that I have mentioned, can do to assist us to move forward.
And what was his response like then, especially at the back of everything that you have mentioned and as far as the progress that you have made on your end? What did he say in response? We know we'll probably get an opportunity to engage him in that media briefing, but just a sense of what the World Health Organization says in response to what has been done by South Africa.
They were very, very happy and pleased. Remember that the hosts for him and the minister are both ourselves and the Department of Health. So they were both impressed with the knowledge of the institutions in South Africa and what Afrigen has done in terms of really getting ready and the progress that they have made in the research and development of the manufacturing of the vaccine. He was also given the opportunity to see vaccination sites that are done in private sector company. We visited a company in Paro where the vaccine is done, organized by the South African Catering Union. And he was impressed by both what we're doing in terms of progress in the vaccination, but he was also very impressed about the progress on the research, the capacity that exists in South Africa, and thirdly, the support that the government of South Africa has provided to the institutions to get to the level where we are. He said he was not when they made this announcement, he wasn't sure that we would have made such a significant progress within such a short space of time.